My name is Dr. Andrew Anderson at Kaya Health, and I wanted to introduce our Depression Diagnostic Clinic. Treating depression is something that is very near and dear to my heart. It's affected all of us. We have been working here to try to make it better, and I wanted to include you guys in on that. I was raised by a psychologist back in the 90s when they used to call them shrinks. My dad, my brother still practice psychology. It's one of those things where we would talk about the changes they made to the DSM-5 over Thanksgiving dinner. So I very much feel that psychologists are some of the unsung heroes of healthcare. And I wanted to work with you in regards to depression and changing that in our community. Depression, in the traditional medical sense, is treated as a disease. When somebody comes in and they're depressed, often a physician will treat them with medication in hopes that they get better. We try to take a more holistic approach and look at the many different things that can cause depression, and that usually depression is a symptom of a whole host of other issues. We are trying to streamline this with our Depression Diagnostic Clinic. We take a comprehensive look at the many things that can cause somebody to have an increased risk of depression, and that involves things like evaluating psychosocial issues, looking at medications that have depression as a side effect, and then doing extensive blood work to look at this. We have a specific panel of blood work that we look at for this, and this is noteworthy. It's comprehensive, and it's the only thing that we charge for in this Depression Diagnostic Clinic. In other offices will cost greater than $5,000. This is very much a labor of love, something we're all here passionate about. And so we've whittled that down all the way to $475, and that's the only thing that patients will be charged for. We don't even charge them to see our physicians. Each patient will come into the Depression Diagnostic Clinic for 2 visits. There, we'll learn a lot about them, about what's causing their depression, discuss options for treating some of these lab abnormalities if they exist with either their primary care doctor or transitioning to us being their primary care doctor, and then we'll set them up with a counselor. We've recognized that having patients do that on their own, set up a counseling appointment, is a huge obstacle, and often it just doesn't happen. To try to eliminate that, we're going to set that first appointment up with a counselor while they're here in the office. As such, we're making a registry with counselors, some information about them so that we can help the patient make an informed decision about who they're seeing and try to make sure it's a good fit for them, and then set that first appointment. So I wanted to invite you to sign up for our registry, and I also wanted to invite you to come meet us. We'd love to meet you. We'd love to show you our facilities, talk to you about what we're doing here, and see how we can help you in this fight against depression. We have something coming up, networking social, here at the end of September, and we'd love for you to come out to it. If you have any questions at all, reach out to us. We'd be happy to help, and we really just want to connect and make things better in our community. Thanks.